Dear friends, hello and welcome. Today I am going to deliver a lecture on edema, hyperemia, congestion and hemorrhage. Now let us first try to have a look at the main objectives of today's deliberation. Number first is to give a general introduction about edema. Number second is to learn about the phenomenon of hyperemia. Number third is learning about congestion and factors associated with it. And finally, we shall be learning about hemorrhage. Now, we will start with the introduction about edema. Edema is an abnormal accumulation of fluid in the interstitium located beneath the skin and in the cavities of the body, which can cause severe pain. Clinically, edema manifests as swelling. The amount of interstitial fluid is determined by the balance of fluid hemostasis and the increased secretion of fluid into the interstitium, or the impaired removal of the fluid can cause edema. Edema can be isolated to a small area or affect the entire body. Medications, infections, pregnancy and many medical problems can cause edema. Edema is a normal response of the body to inflammation or injury. For example, a twisted ankle, a bee sting or a skin infection will all result in edema in the involved area. In some cases, such as in an infection, this may be beneficial. Increased fluid from the blood vessels allows more infection-fighting white blood cells to enter the affected area. Edema can also result from medical conditions or problems in the balance of substances normally present in blood. Cutaneous edema is referred to as pitting when, after pressure is applied to a small area, the indentation persists after the release of the pressure. Peripheral pitting edema is the more common type, resulting from water retention. It can be caused by systemic diseases, pregnancy in some women, either directly or as a result of heart failure, or local conditions such as varicose veins, insect bites and dermatitis. Non-pitting edema is observed when the indentation does not persist. It is associated with such conditions as lymphedema, lipedema and myxedema. Edema caused by malnutrition defines Kwashiorkor, an acute form of childhood protein energy malnutrition characterized by edema, irritability, anorexia, ulcerating dermatosis and an enlarged liver with fatty infiltrates. Some of the causes of edema include: number first is low albumin, that is hypoalbuminemia. Albumin and other proteins in the blood act like sponges to keep fluid in the blood vessels. Low albumin may contribute to edema but isn't usually the sole cause. Number second is allergic reactions. Edema is a usual component of most allergic reactions. In response to the allergic exposure, the body allows nearby blood vessels to leak fluid into the affected area. Number third is obstruction of flow. If the drainage of fluid from a body part is blocked, fluid can back up. A blood clot in the deep veins of the leg can result in leg edema. A tumor blocking lymph or blood flow will cause edema in the affected area. Number fourth is critical illness. Burns, life-threatening infections or other critical illness can cause a whole body reaction that allows fluid to leak into the tissues almost everywhere. Widespread edema throughout the body can result. Number fifth is edema and heart disease, that is congestive heart failure. When the heart weakens and pumps blood less effectively, fluid can slowly build up, creating leg edema. If fluid buildup occurs rapidly, fluid in the lungs, that is pulmonary edema, can develop. Number 6 is edema and liver disease. Severe liver disease, that is cirrhosis, results in an increase in fluid retention. Cirrhosis also leads to low levels of albumin and other proteins in the blood. Fluid leaks into the abdomen called ascites and can also produce leg edema. Number 7th is edema and kidney disease. A kidney condition called nephrotic syndrome can result in severe leg edema and sometimes whole body edema. Number 8 is edema and pregnancy. Due to an increase in blood volume during pregnancy and pressure from the growing womb, mild leg edema is common during pregnancy. Number 9 is cerebral edema, that is brain edema. Swelling in the brain can be caused by head trauma, low blood sodium, high altitude, brain tumors, or an obstruction to fluid drainage. Headaches, confusion and unconsciousness or coma can be symptoms of cerebral edema. Number 10 is medications and edema. Numerous medications can cause edema, including non-stimulatory anti-inflammatory drugs, calcium channel blockers, corticosteroids, pramiprazole. 6 factors can contribute to the formation of edema. Number 1, increased hydrostatic pressure, reduced colloidal or oncotic pressure within the blood vessels, increased tissue colloidal or oncotic pressure, increased blood vessel wall permeability, for example inflammation, obstruction of fluid clearance in the lymphatic system, changes in the water retaining properties of the tissues themselves. Raised hydrostatic pressure often reflects retention of water and sodium by the kidney. Edema symptoms depend on the amount of edema and the body part affected. Edema in a small area from an infection or inflammation such as a mosquito bite may cause no symptoms at all. On the other hand, a large local allergic reactions such as from a bee sting may cause edema affecting the entire arm. Food allergies may cause tongue or throat edema, which can be life-threatening if it interferes with breathing. Treatment of edema often means treating the underlying cause of edema. For example, allergic reactions causing edema may be treated with antihistamines and corticosteroids. Edema resulting from a blockage in fluid drainage can sometimes be treated by eliminating the obstruction. Blood clot in the leg is treated with blood thinners and the clot slowly breaks down. Leg edema then resolves as fluid drainage improves. A tumor obstructing a blood vessel or lymph flow can sometimes be reduced in size or removed with surgery, chemotherapy or radiation. Now that we have understood what edema is, now let us discuss another phenomenon, that is hyperemia. Hyperemia is the increase of blood flow to different tissues in the body. It can have medical implications, but is also a regulatory response allowing change in blood supply to different tissues through vasodilation. Clinically, hyperemia in tissues manifests as erythema because of the engorgement of vessels with oxygenated blood. Hyperemia can occur also due to a fall in atmospheric pressure outside the body. Functional hyperemia is an increase in blood flow to a tissue due to the presence of metabolites and a change in general conditions. When the tissue increases activity, there is a well-characterized fall in the partial pressure of oxygen and pH, an increase in partial pressure of carbon dioxide, and a rise in temperature and the concentration of potassium ions. The mechanism for vasodilation is unclear, but it may have something to do with the opening of precapillary sphincter. Coming to the functional hyperemia. Functional hyperemia or metabolic hyperemia or arterial hyperemia or active hyperemia is the increased blood flow that occurs when tissue is active. When cells within the body are active in one way or another, they use more oxygen and fuel such as glucose or fatty acids than when they are not. Increased metabolic processes create more metabolic waste. The byproducts of metabolism are vasodilators like carbon dioxide, H positive ion, K positive, lactate, adenosine, etc. Local arterioles respond to metabolism by dilating, allowing more blood to reach the tissue. This prevents deprivation of the tissue. Conversely, when the tissue is less metabolically active, it produces fewer metabolites which are simply washed away in blood flow. Since most of the common nutrients in the body are converted to carbon dioxide when they are metabolized, smooth muscles around blood vessels relax in response to increased concentrations of carbon dioxide within the blood and surrounding interstitial fluid. The relaxation of this smooth muscle results in vascular dilation and increased blood flow. Some tissues require oxygen and fuel more quickly or in greater quantities. Example of tissues and organs that are known to have specialized mechanisms for functional hyperemia include: number first, the brain through the neuron-dependent hemodynamic response. Number second, penile erection tissue by release of nitric oxide. Next is reactive hyperemia. Reactive hyperemia or venous hyperemia is the transient increase in organ blood flow that occurs following a brief period of ischemia. Following ischemia, there will be a shortage of oxygen and a build-up of metabolic waste. This is commonly tested in the legs using Buerger's test. Reactive hyperemia often occurs as a consequence of Raynaud's phenomenon, where the vasospasm in the vasculature leads to ischemia and necrosis of tissue, and thus a subsequent increase in blood flow to remove the waste products and clear up cell debris. There are no characteristic changes from hyperemia, either active or passive. In the active form, there may be a slight increase in the puncta vasculosa and a darkening of the white substance, while the veins and sinuses may be filled with dark blood in passive congestions, and there is more or less edema of the tissues. Active hyperemia is characterized by the flushed face, bright eyes, contracted pupils, and throbbing of the carotids. There is more or less headache of a throbbing character. The patient is irritable and restless with more or less insomnia. Now, let us discuss the next part of our today's lecture, that is congestion. Congestion is an abnormal or excessive accumulation of a body fluid. The term is used broadly in medicine. Examples include nasal congestion, that is excess mucus and secretion in the air passage of the nose seen with a common cold, and congestion of blood in the lower extremities seen with some types of heart failure. Sinus congestion refers to a feeling of fullness in the sinuses. These conditions can occur together or separately. The common cold virus, that is respiratory syncytial virus, that is RSV, can cause severe congestion and pneumonia in small children. While many small children are hospitalized with RSV each year, in adults RSV usually causes regular cold symptoms that go away in a week or two. Sinus congestion, also sometimes called sinusitis, results in a feeling of fullness in the face, especially around the eyes, cheeks, and forehead. It can cause severe headaches. It is often associated with a cold virus or occasionally a bacterial infection as well as allergies. Nasal congestion is the blockage of the nasal passage, usually due to membranes lining the nose becoming swollen from inflamed blood vessels. It is also known as nasal blockage, nasal obstruction, blocked nose, stuffy nose, or plugged nose. Nasal decongestants target the discomfort directly. These come as nasal sprays, inhalers, and as oral pills. Nasal congestion has many causes and can range from a mild annoyance to a life-threatening condition. Nasal congestion in an infant in the first few months of life can interfere with breastfeeding and cause life-threatening respiratory distress. Older children and adolescents, it is often just an annoyance but can cause other difficulties. Nasal congestion can interfere with the hearing and speech. Significant congestion may interfere with sleep, cause snoring, and can be associated with sleep apnea. Nasal congestion can also cause mild facial and head pain and a degree of discomfort, often from allergies or the common cold. Its causes: allergies like hay fever, allergic reaction to pollen or grass, common cold or influenza, deviated septum, reaction to medication, rhinitis medicamentosa, a condition of rebound nasal congestion brought on by extended use of tropical decongestants, Sinusitis or sinus infection. Pregnancy may cause women to suffer from nasal congestion due to the increased amount of blood flowing through the body, nasal polyps, concha bellusa, empty nose syndrome, gastroesophageal reflux disease, etc. Nasal obstruction characterized by insufficient airflow through the nose can be a subjective sensation or the result of objective pathology. It is difficult to quantify by subjective complaints or clinical examinations alone. Hence, both clinicians and researchers depend both on concurrent subjective assessment and an objective measurement of the nasal airway. Often a doctor's assessment of a perfectly patent nasal airway might differ with the patient's complaint of an obstructed nose. The treatment of nasal congestion frequently depends on the underlying cause. Alpha adrenergic agonists are the first treatment of choice. They relieve congestion by constricting the blood vessels in the nasal cavity, thus resulting in relieved symptoms. A cause of nasal congestion may also be due to an allergic reaction caused by hay fever, so avoiding allergens is a common remedy if this becomes a confirmed diagnosis. Antihistamines and decongestants can provide significant symptom relief, although they do not cure hay fever. Now coming to the last part of our today's lecture, that is hemorrhage. Bleeding, technically known as hemorrhaging, is blood escaping from the circulatory system. Bleeding can occur internally where blood leaks from blood vessels inside the body or externally either through a natural opening such as the mouth, nose, ear, urethra, etc. Hypovolemia is a massive decrease in blood volume, and death by excessive loss of blood is referred to as exsanguination. Typically, a healthy person can endure a loss of 10 to 15% of the total blood volume without serious medical difficulties. The stopping or controlling of bleeding is called hemostasis and is an important part of both first aid and surgery. Hemorrhaging is broken down into 4 classes by the American College of Surgeons Advanced Trauma Life Support. Number first, Class 1 hemorrhage involves up to 15% of blood volume. There is typically no change in vital signs and fluid resuscitation is not usually necessary. Number second is the Class 2 hemorrhage, which involves 15 to 30% of total blood volume. A patient is often tachycardic, that is, rapid heartbeat with a narrowing of the difference between the systolic and diastolic blood pressures. The body attempts to compensate with peripheral vasoconstriction. Number third is Class 3 hemorrhage, which involves loss of 30 to 40% of circulating blood volume. The patient's blood pressure drops, the heart rate increases, peripheral hypoperfusion, that is shock, such as capillary refill, and the mental status worsens. Next is Class 4 hemorrhage, which involves loss of more than 40% of circulating blood volume. The limit of the body's compensation is reached and aggressive resuscitation is required to prevent death. This system is basically the same as used in the staging of hypovolemic shock. Individuals in excellent physical and cardiovascular shape may have more effective compensatory mechanisms before experiencing cardiovascular collapse. Bleeding arises due to either traumatic injury, underlying medical condition, or a combination of both. Traumatic bleeding is caused by some type of injury. There are different types of wounds which may cause traumatic bleeding. These include, number first, abrasion, also called a graze, is caused by transverse action of a foreign object against the skin and usually does not penetrate below the epidermis. Number second is excoriation. In common with abrasion, this is caused by mechanical destruction of the skin, although it usually has an underlying medical cause. Number third is hematoma, caused by damage to a blood vessel that in turn causes blood to collect under the skin. Number fourth is laceration, that is irregular wound caused by blunt impact to soft tissue overlying hard tissue or tearing, such as in childbirth. Number fifth is incision, that is a cut into a body tissue or organ such as by a scalpel made during surgery. Number 6 is puncture, that is wound caused by an object that penetrated the skin and underlying layers such as a nail, needle or knife. Number 7 is contusion. Also known as a bruise, this is a blunt trauma damaging tissue under the surface of the skin. Number 8 is crushing injuries, caused by a great or extreme amount of force applied over a period of time. The extent of a crushing injury may not immediately present itself. Number 9 is the ballistic trauma, caused by a projectile weapon such as a firearm. This may include two external wounds, that is entry and exit, and a contiguous wound between the two. Medical bleeding denotes hemorrhage as a result of an underlying medical condition, that is cause of bleeding that are not directly due to trauma. Blood can escape from blood vessels as a result of three basic patterns of injury. Number first is intravascular changes, that is changes of the blood within vessels. Number second, intramural changes, that is changes arising within the walls of blood vessels. Number third is extravascular changes, that is changes arising outside blood vessels, for example Helicobacter pylori infection, brain abscess and brain tumor. Now coming to the cerebral hemorrhage. A cerebral hemorrhage is a type of intracranial hemorrhage that occurs within the brain tissue. It can be caused by brain trauma or it can occur spontaneously in hemorrhagic stroke. Non-traumatic intracerebral hemorrhage is a spontaneous bleeding into the brain tissue and may be caused by increased exertion, tension or stress. A cerebral hemorrhage is an intraaxial hemorrhage, that is, it occurs within rather than outside the brain tissue. The other category of intracranial hemorrhage is extraaxial hemorrhage, such as epidural, subdural and subarachnoid hematomas, which all occur within the skull but outside of the brain tissue. There are two main kinds of intraaxial hemorrhages, that is intraparenchymal hemorrhage and intraventricular hemorrhages. As with other types of hemorrhages within the skull, intraparenchymal bleeds are a serious medical emergency because they can increase intracranial pressure, which if left untreated can lead to coma and death. Last is subarachnoid hemorrhage. A subarachnoid hemorrhage is an uncommon type of stroke caused by bleeding on the surface of the brain. It is a very serious condition and can be fatal. Subarachnoid hemorrhages account for around 1 in every 20 strokes in the United Kingdom. There are usually no warning signs, but a subarachnoid hemorrhage sometimes happens during physical effort or straining, such as coughing, going to the toilet, lifting something heavy or having sex. The main symptoms of a subarachnoid hemorrhage include a sudden agonizing headache, which is often described as being similar to a sudden hit on the head, resulting in a blinding pain unlike anything experienced before, a stiff neck, feeling and being sick, sensitivity to light, that is photophobia, blurred or double vision, stroke-like symptoms such as slurred speech and weakness on one side of the body, loss of consciousness or convulsions, that is uncontrollable shaking. That is all about today's lecture. Hope you have understood it very well. Thank you very much.